Hi, I'm Christine Brookins, and this is Connecting Our Community. Today, I have the honor of speaking with Pennsylvania State Representative Dan Miller of the 42nd District of Pennsylvania. Representative Miller, thank you for having me here today. I really appreciate this.
Yeah, good to talk to you, Christine. Thanks for coming in.
Well, it's one of these things that's been building up for years because I work in the disability space and you have been so passionate about serving the disability community. So I really want to jump in with your Disability Summit.
Yeah.
12 plus years ago, you took office, and it seems like this is one of the first things that you did. Am I right about that?
Yeah. Well, it had to be the first, a couple months we got it going. But yeah, no, it was a priority of mine. Again, I can't say it was, my idea totally. What we took the idea off of both the recognition that state reps or legislators often do events like senior fairs or veterans events, and those are great. But I was like, I thought that there was a need for us to go into the disability and the mental health space, and that if we can do it regionally in a close proximity to where I thought people would be able to get to and travel to, and then do it for free, then I thought that more people can take advantage of it. So that was the idea. But yeah, it was the first real big event anyhow that we planned.
Well, and it's been growing every year that I've seen.
Yeah, I mean, look, the post-pandemic did have some degree of shift as we adapted to, virtual meetings. There are aspects of the disability community who were more sensitive to COVID, and so there are some parts of that came back a little slower. Some parts of it did not come back. And so post-pandemic, the summit is like many formats in the sense that it had to adjust to how people were comfortable in conversing, dialoguing, and getting information. But we're very proud of it. We kind of average in about 1,300 people a year, which isn't bad.
It is not bad at all.
Yeah.
And I do know what I have seen personally is the partners you've made in the community and the vendors that those 1,300 people get to meet. You're bringing everything to one hub.
Yeah.
And that really, I think, is crucial for the disability community. I think that the one thing that you bring that I've never seen anyone else, at least in this region, is that legislative side.
Yeah. Well, and that it's organizations, do a lot of great events. So we have partners who do their own. Some would take our summit term, which is fine, and use that as well. That's great. One of the challenges, of course, is that disability and mental health seldom exist in silos.
Absolutely.
And so we never took it that we had to be a disability event, and what is a disability, what qualifies as a disability. We never took it that we had to be a mental health event and what qualifies as mental health. And that instead, what we realized was there was much that not only did people have, a lot of people have both of disability and a mental health diagnosis, but the issues that impacted their lives and future were very much the same. So we did not feel that it was worth drawing a distinction. Secondly, was our goal was that when you do an event that's one of our great partnering organizations and they go, this is this organization's event, then the event is their organization event. And that's great in many ways, but one of the challenges is we didn't think it brought, some people weren't as comfortable to come to somebody else's organization's event. And so we're like, how do we get everybody together? Well, if you do it under the umbrella, like a senior fair that a rep may typically do, you do it under an umbrella of Dan Miller's Disability Mental Health Summit, everybody's invited, then more likely everybody comes. So we, last year's summit, we had 3 types of resource fairs because parts of the event went on 3 different days. The largest one I think had about 145 at one time, organizations present. Our biggest one we ever did was for the 30th anniversary of the Americans with Disabilities Act. And that one there probably had about 300 organizations present. So we try to bring everybody in.
And that one was at the convention center in downtown
Yes.
Pittsburgh. So that was a big deal.
Yeah, that was unique. Yeah, that was a big deal, and we appreciate all the partners. That took a little more planning.
I'm sure.
The convention center is fantastic space. It's a great thing for Pittsburgh. It's not without its cost, and so that was an aspect. The majority of our summit over the 12 years has occurred at the Bethel Synagogue, which is right on the border of Mount Lebanon and Scott Township. They were fantastic partners and had a great facility. Loved them. Their congregation was so embracing from day one. It took about 5 minutes to get them on board. But having a partner like that allowed us to control costs.
Yes.
And their space, again, was perfectly designed for it. Unfortunately, due to increased safety concerns,
Yes.
It was time for a change. But they were fantastic. And now, last year, and then what comes up in 2026 will be at CCAC, right at the Allegheny, the main campus on North Side, which they were a great partner last year. And we're adapting and melding the platform or the product to that platform in a way that we hope continues to give great opportunities for people.
Well, and for anybody that may be watching this that has never had the opportunity to attend the summit, I want to take a step back because so many people, so many organizations are involved, but you and your staff really put a lot of time into what are the main stage sessions as well as what type of breakout sessions are going to be valuable to the audience. How does that come about?
Yeah, so there, our summit gets, there's both the resource component, the resource fair component, and then there is the program side, right? So largely we kind of put them into two bits. We always add a legislative thing, which kind of falls into our third, meaning there's always a legislative panel. Traditionally, it's been bipartisan, bicameral. Again, ebbs and flows depending on the year, but that is something else that we bring that sometimes can be difficult for other organizations to replicate. The program side is very key. So I always think that for a lot of families, when they're new to a diagnosis, it can be overwhelming.
Yes.
You could take somebody through 100, 200, 300 organizations, dump all the material into a bag for them, and send them on their way. And likely what you've done is overwhelm them with information that will be challenging for them to find their particular entry point in. The program sessions allow for more specific learning to occur. And I think that that's a key thing for the summit. So each year we get together a planning committee, and we take roughly 3 to 5 months, depending on the year, to develop programming. And it will go from anywhere from about 20 programs to, I think the one at the convention center had like 45, right? So each one is an hour of programming. We try to diversify the topics. So that's when we do look at, we want to be sure there's disability and mental health. We want to be sure there are programs that bring both issues together in a way that makes sense. We want to be sure if you have autism, there's something for you. If you have a physical disability, there's something for you. If you have depression, if you have anxiety, right? We try to make it that everybody has something there. So sometimes I come up with session ideas on my own. Sometimes they work great. Sometimes I'm corrected. Often, though, what we do is we put out an RFP, which I believe it actually may go out this week for the 2026 summit. The RFP is just requesting proposals. We are very blessed to have a decent network of organizations that contribute some of their best. So that is also helpful in designing a program. We don't like to repeat. I don't think we ever repeat actual programs. We may repeat topics.
Sure.
Right? So transportation, right? Transportation is an issue that we have probably discussed out of 12 summits, maybe 7 of them, 8 of them, something like that. It's a reoccurring, constant struggle for people to access, right? Early intervention, as broad as that sounds, I'm sure every summit has touched on early intervention in one way or the other. But we always try to bring a different perspective. So there is no repeating the exact same program. The goal is diversity in the offerings as a way to ensure that everybody can see themselves here, and there's a reason for people to come back year after year.
And when you're developing that program, I'm wondering how much of the ideas for programming come out of inquiries that come through your office or at the prior year's summit
Yeah.
versus maybe what is really going on in Harrisburg right now?
Not many come from Harrisburg. So most of it comes from individual discussions that I have or my staff might have.
Okay.
Somebody brings up to us, they've come from emails, they've come from conversations I've had with somebody at Giant Eagle's parking lot, right? So, and sometimes I just get a diagnosis and I go, okay, you know what, let me think about that. Eating disorders is one of those examples. That was something that we had not spent much time on. I think we've done it now maybe 2 out of the last 3 years. But eating disorders had just not been there. And so somebody brought it up to me. That was a direct one-on-one conversation, letting me know their experience that their family was having. That led to another family conversation detailing a similar concern. And so we corrected our oversight, right? That's what really makes the summit work, is that sort of direct engagement. It really really, to be honest, if somebody just calls me, we have a fair chance of debating ideas together and finding something new. We can't do everything, right? So, and sometimes there's like a couple programs where you're like, oh, I wish we were able to put that in this year. But when you're balancing out, because I don't want it to be, if we're just looking for a mental health conference, then a group like NAMI is fantastic, right?
Absolutely.
NAMI conference is there. If we're just doing something on autism, if we're just doing something, right, that's fine. But our conference, our summit has to be a place where hopefully the vast majority of people with disabilities can see themselves here, represented, maybe as a presenter, but can see themselves here and see the value of being here and then coming together. That's the goal.
Well, and I personally have attended and participated in all of this to see that sometimes you start with a theme, but you always want to be inclusive of everyone. I believe when you first started, there was more of a focus on children
Kids.
and youth.
Yeah.
But you've had adult sessions, you've had information with veterans. You mentioned the transportation. Obviously, children aren't taking transportation on their own. So it is one of these things. Even to get to the summit, sometimes transportation is a concern.
Oh, yeah, definitely. Look, that's, we did start with a focus on kids. That was quickly altered. What we didn't realize, you got to remember when we started, is I didn't know if it would work. So the first summit we did, in my mind, lasted 6 hours. Had a resource component to it that was modest, and maybe, I don't know, 3 or 4 sessions that were there, right? But we had no idea at the time. Nobody at least was offering us a pathway. We had to create it. So we didn't know. So most of my experience had been with kids before I was elected. It was more of a place where I was comfortable and I felt that I could offer some guidance as sort of the host of the event, right? But once we kind of got the ball rolling, there was no reason or need or value in drawing lines.
Oh, absolutely not.
Yeah.
And I think the coming
we weren't
to
going to card you on the way in. We weren't going to be like, no, I'm sorry, you're out. You pack that thing and get out of here. No.
I think that many organizations start their efforts because there's a family living with it. Mm-hmm. And so it's common to start with children. Any of us who have children are going to want to help support them, but those children grow up.
Yeah.
And there are people with acquired disabilities. And I believe your summit is targeting all of those areas and providing resources accordingly. But I do think along the way, I've seen that evolution, and every day there's a need for a resource for a child.
Yeah, look, I like your point though with acquired disability. Look, again, we didn't start there, but we were quickly illuminated by certain issues. There are things that we struggle to balance. Even each year, I'm trying to be sure that it isn't 70% one disability and 30% mental health, right?
Right.
Or physical disabilities. Probably, I don't know, 6 years ago, somebody raised a good point, and when we did our analysis of it, they were not represented strongly enough. Some of that came from the deaf-blind community bringing the issue up to us. So we adapt. I think I appreciate the patience, because I think some people come up and they think that I'm an expert, right? And they say, oh, we'll go talk to Dan Miller, right? And I'm like, look, the closest I could say is educationally, I took the basics of special education for my teaching degree, right? And that was it, right? So I have no formal training. I'm just some degree of a fair listener, and that has paid well, with an idea that I believe that the ADA was our last major civil rights piece of legislation in our country. And it bothers me whenever I see our country falling a little bit short of being as inclusive across the board, no matter what issue, race, religion, anything. Whenever I see that, I want to help our country be more successful as an opportunity for everybody. And so the disability and mental health community, I felt was not getting enough attention, given the size of the impact. Right. And that's the other thing too that I do have to say. One of the reasons I loved the topic is not only because I felt that it was personally something that made a difference to people's lives, but it made a difference to anybody who was impacted. Sometimes, especially in today's hyper-partisan climate, maybe elected officials spend too much time talking to their base. Here's an issue that a Republican likes, a Democrat likes, depending on what your political identity is. What I love about disability and mental health is it makes no party affiliation. There's
Absolutely
no
does
distinction. Not. Right. At our resource fair, at our planning committee, there are Republicans, Independents, Democrats at the table. I don't even remember I know they're there, but I don't remember who's what. It doesn't matter, right? Because we're all going, how can we make things better? How can we improve the system? How can we create more opportunity for everybody? That all too often, working on that common cause, to be honest, over the last 12 years in the legislature has been something that I felt has been decreasing as far as opportunities. This summit gives me a platform to connect with people who may not otherwise say, politically, I agree with Dan Miller. Instead, what I appreciate is they're like, I don't care about Dan Miller's politics. What I care about is we have goals that we can work together on to make life better for people. Let's get that done.
Well, I think that's a great segue to talk about some of the legislative panels you've had, because you do bring in folks that are serving on both parties, come in, and you've had testimony from people within the disability community that I personally have found enlightening, but I've also seen the interaction. It's an opportunity to learn about something you don't know and to ask questions instead of many people are forming an opinion and perhaps voting on limited information. So I have seen it in what you've presented, and when I say present, you've presented the opportunity. Because when you have these legislative panels, what I have noticed is you're not presenting the information. The information is coming directly from the members of the disability community. Can you tell me, first of all, how you were able to make that happen, and then let's also look at what do you think the influence has been afterwards?
So, yeah, there's a lot there. Look, I've only been successful in this regard because good people cared. And that included, again, I say this as a Democrat, it's Republicans have been willing to stand up and come to the event. It ebbs and flows a bit, right? I remember early on our schedule worked a lot tighter with Senator Bartolotta in Washington County, just fantastic. She wore her interest on her sleeve. I appreciate it. More likely now, I'm able. I think Representative Schaefer from the North Hills was there last year. I've always had a good relationship with my local friends on the other side of the aisle, Senator Robinson, Representative Mihalik, for example, who've been there most times. Senator Robinson has presented himself as a veteran on some issues. So the whole thing, I think, is that people have recognized that when they come to the event, there's no partisan attack that's being ready, that's going to be levied on them. That's not it. I would be very disappointed if anybody made it that. It doesn't help the cause.
Correct.
I do not believe if disability or mental health gets seen as one party's playground of issues over another, then the community loses. It won't work, or at least large-scale improvement won't be made. The ADA itself was passed by a Democratic House under a Republican president, right? So that's what we need. So I think that I get a little concerned. To be honest, I hope that we can see a strong bipartisan turnout this year. It's been stronger in years past, to be honest with you, but there's an effort there. I think that we've got enough of a reputation at the event that it allows it to work. We were the only place. I'm unfamiliar with the panel that we do being replicated anywhere else.
I have not seen it.
Yeah. So I don't know that. So we make an effort. It is a clear effort with it, and then I promote everybody who's there too, which is kind of funny because that's not common either. But we started. It's like if a Republican legislator tells me they're coming, I will create that graphic and put it on every one of my social media platforms that I can, because I thank them so much for coming. It means something. And don't get me wrong, the Democrats have been, fantastic as well. But as a member of that party, it's a little bit easier for me to get them. But again, Senator Costa, to the entire Allegheny County delegation, it's been lifted up by legislators who care, and that's what makes that work. And then we try to get on the legislative panel. You're looking for two things, ideally. Number one is something that ties to the legislature, right? Something that can be done by the legislature, right? And then two, a personal connection that helps illustrate it. As an elected official, we all come into these things with our areas of expertise. So I understand that a lot of people on both sides of the aisle may come to my event very unfamiliar with aspects of what an IEP is or something, right?
Right.
Fair enough. If you were to take me to something on international banking, I'm going to be taking a lot of notes, okay? So every legislature, every elected official coming with their area of expertise. Our goal is, in the panel, is to elevate, right, certain things and to make it so the educational gap is a little bit narrower when it comes to the big decisions that come across the board. Even if you don't remember what an acronym is, if we can have you connect with a self-advocate story,
Yes.
right, then that has a chance of moving a bill or moving a budget item a little bit better than not. So that's the goal. And I think we've been modestly successful in doing it, but there's still a ways to go.
Well, as you're speaking about that and connecting with the story, I believe it was 2 years ago, you had a discussion around folks who are incarcerated and what the experience of an incarcerated person with a disability is like. And there were some very telling stories there. But I found that the panel seemed to pay attention to that.
Yeah.
It wasn't whether you're Democrat or Republican. It was getting to that human side and recognizing that there's a need for change.
Yeah, look, it's I do remember that too. I thought that was a really strong. That was a good program overall, top to bottom. That was a good program. But yeah, it was really strong. Look, that's what legislators are looking for, really. Most of us want to connect and then hopefully want to help, right? So when you come into an office, the goal is, no matter whose office, no matter where, can you connect, can you help, right? That's what legislators overwhelmingly are trying to do. When there's a information gap, it needs to be overcome for some of those issues. You look, human services as a broad category is a massive part of the state budget. I talk a lot about Medicaid. I talk about Medicaid because it's a nonpartisan program. It's a nonpartisan issue. It helps people from all across the board.
Right.
But there's a massive state and a massive federal component partnership that makes this program work to any regard. And I'm not saying it was funded fantastically beforehand. But there's big issues here. So the state is either a pass-through or a partner, one way or the other, in helping to make sure counties, another part of the equation, have some of the funding and everything that Medicaid's working. And able to, when tough decisions have to be made in Harrisburg, we want to be sure that as much of promises made are promises kept. And that means making sure that a state budget, to which we're still trying to work on here on agreement, fulfills those promises, especially to populations to which the need is so great.
Yes.
And the promises have to be there. So Medicaid reflects that type of promise, those types of issues. And we've seen when aspects like mental health line items in particular are dropped or severely cut from the state side, and the negative repercussions and how long it takes for us to get back to that level of funding, and then the harm that it causes while those services are not accessible.
What you just brought up about the importance of Medicaid and that funding and the partnership is really crucial to this entire community. And I don't just mean the disability community, because to your point, if there's an impact to one, it's an impact to all. So I really think that the sessions that you've been able to host and the information that you've been able to provide hopefully connects people with more information. You mentioned narrowing that education gap, right? Mm-hmm. If folks learn more, because we all have to balance a budget in our own household, and sometimes there are things you're going to have to cut. Maybe you're not going out to the movies every week or whatever it is. Mm-hmm. But I think it's crucial to educate people on what Medicaid really does provide, and that it is not just a slush fund. This is quality of life.
Yeah, no, definitely not. And look, I learned last May, we were concerned a little bit about some aspects. We started pushing into Medicaid, Josie Badger, Dr. Badger did a great job with some others as well. In talking about Medicaid, right? This past August, my office just did, I think, 5 Medicaid Lunch and Learn virtual sessions, yes, which are available for people to see at repdanmiller.com, just to sort of hopefully answer some questions about what we're hearing from our federal partners, right? Nobody wants money to go to people who don't deserve it.
Correct.
By the same token, we're still a state with a hell of a lot of waiting lists, all too often I'm afraid that some of the efforts to strengthen aspects of a program has instead pushed people off who otherwise needed to be there. And I get concerned about that. Just like when I go to some of our partnering organizations who help people be sure that they, once a year, fill out the paperwork that needs, yes, to be done. And then they're told, well, you need to do it twice a year. And what's the staffing component? What's the drop rate that is likely to happen? And then what happens after, instead of losing 1% to 2%, you're losing 4% to 5%. And where do those 4 or 5% of people's lives, where do they end up? Because somebody couldn't get the boxes checked correctly. Filling out the paperwork is not fun.
No, it is not.
No, it's time consuming, it's a process now. So I get a little concerned about some of that. What we should be talking about, I think, too, is how to make sure rates are workable.
Yes.
We need to strengthen the system. We still have most industries that relate to Medicaid having too high of a turnover rate. That lack of familiarity and connectivity has an impact on the care often for many people. We still have waiting lists, as we've talked about, that are still impacting too many people who are sitting there on those lists. Thousands in Pennsylvania, thousands. I remember, like in particular, talking about some of the waiver issues, and I was a firefighter here in Mount Lebanon, and when I found out that we had both an emergency list and a critical list, And I said, well, what's the difference? I didn't, as a firefighter, we would have used those terms rather, synonymous with each other. And they said, well, it all depends on the length of how long your caregiver or your family member may survive. So that's how we're basing the difference between the two lists. So, and that doesn't even get us to mental health, which of course we don't have a waiting list for services, although we know that every organization that provides mental health really does have some version of a waiting list.
Sure.
So what are we doing when we're telling people that we need these therapists and so forth to provide services, but we're not going to pay you appropriately to do that?
Right.
And Medicaid being such a heavy player in that regard, without fixing Medicaid, I'm concerned that we're not fixing the waiting list problem.
Well, and I think it is fair for people to be concerned that there are people receiving benefits that do not need them. That is fair. There is something to that. But I think where there's often a mistake is how many we're talking about. And that's a very low percentage. And the concept of filling out paperwork, I know families, and I know personally, there are disabilities that aren't going to go away. And every year if we're filling out paperwork, it is still going to indicate that the individual has the same disability. Now, if you're somebody who fell and got hurt and has gone through therapy, maybe in a year's time you are no longer disabled, and that is fine.
Right.
But I think some acknowledgement that there are conditions that individuals are born with
Right.
that are never going away. And those are things I think that your folks have addressed as well.
Well, we've talked about it. We haven't solved it, right? But I mean, there's clear, types of diagnoses that, like you said, they're not going to change.
Right.
And if we were able to work with our federal partners to streamline that, then we could spend more time on the cases that may shift, may change, and
Yes.
maybe should require a little more attention to details on that,
Yes.
right? So recognize the diagnoses that are not going to change. Find a way to solidify that, make the system reflect that, minimize the amount of time spent on those cases, and then spend it on the others, right? So no, we have talked about, we've elevated and talked that discussion. We have not solved that issue, and I'm not clear that the state is the best regard for that. It may require a little more action on the federal side.
Well, and it's that partnership and the education.
Yeah.
I think a lot of the things that you're bringing up, and even the summits and the panels that you bring together, there's education there. Hopefully folks walk away with something they didn't know before then that can inform decisions they make going forward. And
Yeah.
we could be here all day on any one of these
We're not.
subjects.
I thought we were here for 7 hours. Are we not 7 hours?
7 hours? Okay.
Look, I definitely appreciate the chance, as always, to talk about disability and mental health issues and our summit. I've been proud to see some of my colleagues have replicated some versions of the program out in Philly and in the Northeast, and that was always the goal, right? At the end of the day, it was never, in order for me to help statewide, the disability and mental health cannot be, like I said, a partisan issue. It can't be a Dan Miller issue.
It is not.
Right.
Right.
And it needs to be seen as a responsibility of our elected officials across the board from every party, no matter where you are in the state and the federal government, to keep its promises that were made to a population long ago, and then to expand on it and recognize that we didn't get everything done that we need to. The ADA is a fantastic step. We still are a state and a country where 60-65% of people with disabilities are not engaged in the workforce, right? We still have issues with housing. We still have issues with transportation access. And there are ideas about how to improve those things. In order to do that, it must be a priority issue for people in Harrisburg and people in DC. And on the local side, I don't want to say there's nothing that they can do, especially in schools, but there are some limits just as how dollars get transferred over or can be largely supported. Every time you're in the public arena, you should be thinking about how best to deploy public resources in a way that brings everybody in, right? That pushes nobody out and addresses needs, provides opportunities for when they are needed. And if it's a short-term thing that allows people A, B, and C coverage and then they transition off, fantastic.
Right.
If it's that lifetime commitment because that's how God made somebody or whatever else may come up in the world, then we should be a country strong enough to not only make that promise, but keep that promise. And that's what I hope the summit at all helps with.
I would hope that anyone that has been to a summit has felt they've learned something, had the opportunity to influence someone's opinion about how things will go forward, because I do think a lot of the things that you bring up need to be addressed more universally. And I'm hopeful that by you and I having this conversation, there are folks out in the community that recognize, one, they can turn to their legislators for resources that they may not know exist, because a lot of these families are just hoping to get through the day. And that, two, if there is not something out there, that perhaps a conversation can be had about how can something come into existence that's going to support the community.
The last thing I'll say with it is I've learned things on every summit. So I can't tell you how much I've enjoyed the direct connection to self-advocates or family or allies who come up and talk to me. It's made me a better rep. The summit, in some ways, made me a better person just to understand and reflect more of the challenges. Last thing I'll say on that too is I get a lot of credit, which is nice, right? That's nobody,
Sure.
right? Who doesn't like credit? But the reality of it is I do want to give a quick note that my staff really are the ones who take some idea that I draw up on the board here, and then find a way to make it happen. Legislators are good. Staff help us to do things, and they always answer the phone, no matter whether you're in a Democrat office, Republican office. If you're getting good information, which hopefully you are out of all of us as much as possible, or seeing good events that can make a difference, or want to see more events with the thing, recognize that yes, the reps and senators are key, but the staff, who probably are not getting paid as well as they should be, are the key to us translating things on the ground. So I definitely thank them, all the partners who have helped make the organization of this work, from groups like Every Child to CCAC to Bethel and everybody in between, Achieva, just all these organizations that have helped us do some great things. But without that partnership, nothing happens.
Well, and I think that goes all the way back to the beginning where you started this with partnerships and you have grown. And I think that now more people see that as a two-way street. And because you have been able to do this and your staff has been able to support the effort, it has really been wonderful for the entire community. And I know the folks that I saw coming in the door this morning, I have seen every year that I've participated in the summit. So they're really involved.
Well, May of 20, I think it's May 7th, 2026. We're coming back for one more. So no matter what, May 7th, 2026 at CCAC, disabilitysummit.com, repdanmiller.com. We'll be having more information no later than January about how people can be engaged and involved and see what we're working on. If you have an idea or something that you want to talk about, you can still reach out to me in this office here and talk about topics, things that you'd like to see, anything that would make it better. We're glad to have our kid partnerships working through already with the school districts like Upper St. Clair and Pittsburgh Public and the AIU. So much is already in motion. We're excited for May, and hopefully we'll be able to even help more people there.
I will see you in May. Thank you very much for taking the time today. I appreciate you.
Thanks for coming in.
All right, take care.